We're interested in protecting patients from infection. Obviously, of the cut or being in the hospital, there's this risk that during your surgery or while you're here in the hospital, you could get an infection. So the American College of Surgeons got 117 hospitals together and monitored tens of thousands of surgical patients to look for factors that would identify risks of getting an infection, risks of having a problem or complication. And what they found is really good news for us and for you all this morning. Basically, they looked at the 20 hospitals that had the lowest risk of wound infections and the 13 hospitals that had the highest rates of infection. And they looked at the factors that predicted the risks. Okay, so one of the most powerful predictors was having residents or trainees. Okay, in other words, having a junior person at your operation or in your hospital increased the risk of having an infection. And having spent 10 years, 20 years at the University of North Carolina training residents, my bias is that makes sense. I think that you have to train surgeons, you want to train new surgeons, and there's a good advantage to being in a teaching center, but a resident is in training. They're not a top skilled doctor, they're a new doctor. And there is a difference between new and someone who has more experience. And this study, like many others, has shown that. They found that the average operating time was one of the most powerful predictors. So a long, complicated, difficult surgery, much more likely to result in infection. And of course, we want to be careful how we say this, but our operations are routinely quite short. I don't know if you remember your operative time?
I think mine was like 20, it was under 30, like 26 or something.
Now, some people say, oh, Dr. Rutledge, you're rushing. You know, and that is true. I have golf today. And so we don't rush, but on the other hand, if you have a task that you're going to perform and it takes you between 10 and 15 minutes, or a task that takes 8 to 10 hours. That's an extreme example, but one is obviously simpler and more complex than the other. And as you get more complicated, with more bleeding and more problems, the risk of infection goes up. So we don't want to rush through any of your surgeries today, and so some of our patients will say, gee, Dr. Rutledge, I know you'd like to finish up in a hurry. Hope you'll take enough time to actually do mine well.
Yeah, I prefer that.
That's right. Because we get in there, of course we go, 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 go! No. But we do monitor that because, again, we're not rushing to get through, but it gives us an idea of the complexity of the surgery. So if you just tell me I'm going to have brain surgery, that takes 3, 4, 5, 6, 8, 10, 12 hours. If I tell you you're going to have a mole removed, that's more like 20, 15, 30 minutes. So it's not a perfect correlation, but in general, shorter, simpler operations have a lower risk of infection. They have less stress on your heart. They have a lower risk of heart attack. And this is another study where it confirms that your risk of infection today, having chosen a shorter, simpler operation, means that your risk of infection is less. And I think that's kind of worth pointing out. The other thing they found was anemia, or a low blood count, increased your risk. And of course, we're proud of the fact that I can't recall the last time we had to transfuse anybody. It's been at least 3, 4, 5, 6 or more years. So that is, there's very little blood loss. When you lose blood, you have a more complicated procedure that increases your risk that the body will have trouble fighting an infection. It may have an area where bacteria can grow because that little blood clot can provide sustenance for bacteria. So for all those reasons, again, the risk of infection for this surgery is lower, and so we're happy about that. They found that the best hospitals had lower staff turnover rates and were smaller than hospitals that had more infection. So think about this hospital. This is a little hospital. We don't do heart transplants. We don't do liver transplants. The ICU is quite small. The total number of beds is small. And we have a sister hospital where all those things are different. It's a much bigger hospital. They do heart surgery and bigger operations. And we think that this is the perfect match for you. There are times when you want a great big hospital with lots of expertise and a big intensive care unit and dialysis and pulmonary specialists and things like that. But when you get to that hospital, you have a lot sicker patients, and sometimes they're bringing in other bacteria. You'll have the pulmonologist, the respiratory therapist, the nurse go into that room and maybe occasionally bring back the wrong bacteria. And so this hospital, much shorter length of stay, much smaller. The nurses are less stressed. And so, for example, 2 of the patients who were leaving yesterday commented on how nice the nurses were here, how friendly they were, how they enjoyed coming to the hospital. And that's not because they're necessarily better people, but they're less stressed. There's not a great big person with a great big complication, bleeding or having a complication in the next room to you. So if you have to take care of that, we need to give thanks for the nurses who can do that. And if you and I need that, we want that nurse there for us. But we don't need that today. And so for your little, short, simple surgery, this is the place I think that's a good match for you today. And I think you'll be real happy with the nurses on the floor and things like that. And this study confirmed that.